India, a country caught at the crossroads of tradition and modernity. Tourists have long flocked to this land of color and contrast. But when you think tourism in India, you probably think of the Taj Mahal, the pink palaces of Jaipur, or the backwaters of Kerala. But in recent years, a different kind of tourism has started to take off in India's hospitals. It's called medical tourism. From North America, Africa, and the Middle East, patients are flocking to India in search of medical care. But why India? The southern city of Bengaluru is well known for its IT industries, congested traffic, and, like anywhere else in this country, cricket-crazy people. It's also home to the Manipal Hospital, popular with many medical tourists like Jeff Brishka, an American who lives in Japan but turned to India in search of an experimental bone marrow transplant.
The condition I have is multiple sclerosis, and this is a new treatment for that disease, but bone marrow transplants have been done for 60 years. So this is kind of experimental. Yeah.
The hospital's CEO, Rajan Padukone, says the arrival of patients like Jeff speaks to the quality of India's hospitals.
The fact that you are attracting foreign patients adds significantly to the credibility of the expertise that lies within the hospital. So I think it's a feather in the cap of hospitals if they are able to attract patients from overseas coming here, because patients overseas have options.
For Jeff, India was the only viable option.
Because mostly this treatment for MS is done as a part of a clinical trial, the restrictions for acceptance into the trial are quite severe. It's near impossible to get into a clinical trial. It's very hard to be accepted in the States and some other countries as well. But India was more liberal in their acceptance criteria, and the cost was much lower. I mean, cost in the American healthcare system, for many, many reasons, is very expensive. But the cost has been very reasonable in India.
So even when you take into account flying here and stuff, you think the cost is...
Yes. Yeah.
But it's not just the easy availability of experimental treatments that draws medical tourists here. Many come for urgent life-saving care that isn't available in their own countries. Darlington Aloma suffered from jaundice so severe he barely remembers the treatment he underwent in India.
I was almost a dead human being. I can't just tell you, I don't know what was going on. It's only my wife can explain that. She alone can say, because I don't know what was going on. For more than 2 months, I don't know myself. I didn't get myself right.
Medical tourists here say the hospital experience is a refreshing one, even in comparison to more developed countries.
I can understand how others might be wary of coming to India just because of the perception, that it's not of the same standard in American or OECD countries. But as far as the hospital care goes, I think it ranks equal to. And in fact, it's very efficient in an American hospital and a Japanese hospital. Things have to follow, I believe, I can't say for certain, but things have to follow certain patterns and structures, and things take a long time to get done. But here, it was very quick, very efficient. Everything moved very quickly.
Here, I think they are perfect. They are perfect. They are trying. Yes, each and every one of them, they are serious about the job. They are very dutiful. They take their job very serious.
Additionally, while I'm here doing this, my mother thought she had an infection in a tooth, and so she thought, well, since I'm here doing this, let's check in with the dentistry office in the hospital. And she had some major dental work done for substantially less than she would have paid in the States. So I don't know. Well, I don't know why medical care is cheaper in India, but it certainly is. And it's of the same standard. I didn't notice anything different in the standards between Japan, America, and India. The biggest difference is the cost.
But if the standards of service are so high, how come the cost is so low?
Well, if you look at India today, India, even if you don't look at healthcare, but look at it in other industries, the IT industry has always been a location for outsourcing services, because the quality of labor is of a high standard. The education is typically English, and also the cost of labor is much lower than the cost of labor in the West. So if you translate that into the total cost of the service or the product, it would typically be much lower than what it would be in the West. So you extend that same sort of logic even into healthcare.
The costs may be low, but Jeff insists he was also drawn to India by the reputation of its doctors.
I knew that the doctor that would be working with me here had some experience working with other doctors elsewhere, for example, in the States. And in the States, all of the doctors in the States are Indians. So why would I have any misgivings? Of course I would get the same level of treatment.
Dr. Mohammad Rehan is one such doctor. A product of Harvard University and the Cleveland Clinic, he practices at Fortis Hospital in Bengaluru.
I think you take pure technical skills of us, we are on par with the West. Pretty much shoulder to shoulder with them for everything. The other thing is a large amount of us are trained out of there, so we understand the philosophies, the disease more importantly. And it gives us that cutting edge that a lot of the others don't have. So the Western guys don't have exposure to our disease, but we have an exposure to their disease, so we are able to deliver to the entire spectrum. So that's a big difference.
Dr. Rehan says India holds advantages over other medical tourism destinations in Asia.
The medical tourism industry in India is booming. I mean, not as much as China and Thailand, but definitely we are within the top 5 or probably in the top 3 for sure. One of the advantages of India is our nursing is way ahead of the rest of the world. And the second thing is that compared to China, Thailand, to a large extent we are very fluent in English. And so that is in our favor. Those guys can't talk English, so it hurts them in a large way.
So if there are people in Nigeria who are thinking about coming to India for treatment, what would you say to them?
I would advise them to come, and they will see different things. They will be saved in their life. Because I was almost a dead human being when I came here. So, but they rescued me. So anybody I see that is coming here, I will advise him more to come.
I would say, don't write off India just because of some perception that it's a third world country, because the care is of the same standard that you would find elsewhere.
Jeff and other medical tourists say they've also enjoyed what India has to offer beyond the hospital gates.
Well, I knew it was hot, and it's hot. I thought it was slightly dirty, and it is slightly dirty. It is a developing country. Yeah. It's very interesting. It's very different. Yeah. And, well, that's not a bad thing. It's just been a very interesting trying to navigate in this culture. Just very different. Has been an adventure. Yeah. Yeah, so I guess you could say medical tourism is exactly that. It's, for a medical purpose, but it is seeing more of the world as a tourist.
To Dr. Rehan, medical tourism simply makes good sense.
He can fly you down here and get this done at 1/10 the cost. Even if you travel business class or first class, it's still a saving for him. So the patient gets what he needs to get. So I think that, It's but fair that they travel around the world, not just in India, but across for medical tourism. Is not a bad deal. You get a vacation and you get everything taken care of in the same time. So why not?
Eric Kadeski is a family doctor in Vancouver.
So I have had many patients of mine travel abroad for the purpose of medical tourism. The reasons for these travels have been wide-ranging. Some of them have been for dental care. Some of them have been for major medical care, obtaining procedures that were not available in other parts of the country here in Canada. Some of them have been for procedures where the wait times are very long, and other ones have been for cosmetic care, which can be obtained at a much cheaper price abroad than they can here in Canada.
But the impact of medical tourism extends well beyond patients and hospitals. Indeed, medical tourism has begun creating money-making opportunities beyond the healthcare sector, with the hospitality industry being one of the biggest beneficiaries. This is the Urban Hotel. Located right behind the Manipal Hospital, the hotel has an agreement with the hospital through which it offers hefty discounts to patients and their families.
See, when you're coming into a completely new country, into a completely new, unexplored location, you have to ensure that that whole experience of coming into this country, going through the procedure, recuperating and going back is made seamless and smooth. When you do that, then you tie up with travel agents, you tie up with hotels. So given that, you will have other related businesses also enjoying the fruits of this line of business.
The Online Suites Hotel has been reaping the fruits of medical tourism for as long as it's been around. It's located near Narayana Hrudayalaya, a hospital that attracts many overseas patients. The hotel has a close relationship with the hospital. Here in the hotel owner's office, newspaper clippings about the hospital are prominently displayed. The hotel's owner admits that medical tourists are a crucial part of his hotel's business.
Confidently say we are dependent on them because most of the guests who come here are for the hospital, and we are within a stone's throw away. So when people choose to walk down or walk back from the hospital, it is easier for them. They don't have to depend on any kind of transport. Though we have a free shuttle service which almost does about 60 miles every day, just between the hospital and the hotel, which is less than half a mile apart. So even if it is one person who needs to go at 12 o'clock in the night or 4 o'clock in the morning, depending on the call from the hospital, we are there for him. So that has been our biggest USP, so to say. Now the medical tourism has given a big fillip to our business. We have been getting, of course, we have an equal number of Indian guests also. But with the international patients coming in, we are now encouraged to provide better facilities, and our revenues have also increased, and we are more encouraged to do better.
But hotels like Online Suites are not the only businesses that are flourishing thanks to their proximity to the hospital.
There are related commercial establishments like grocery stores, the taxi services, petrol pumps and things like that. This is a big, small township, so to say, depending on our existing with the hospital.
As medical tourism grows and other industries find ways to support it, it appears that medical tourism in India is here to stay.
I see this market as a hugely growing market with very high potential, and also attractive enough for us to, given the fact that it is a line of business, attractive enough for us to make it as a very focused area for us to market, very focused for us to market to.
One of the most popular means of marketing medical tourism services is through the production of slick testimonial videos.
You would be only in the world's best care. I have absolutely no hesitation in saying that. I am extremely pleased that we found the facility and were able to access its treatment. And I thank them from the bottom of my heart for helping my son.
As Prime Minister of
Successive Indian governments have also done their bit to support the medical tourism industry. India's National Health Policy from 2002, introduced by the government of former Prime Minister Vajpayee, strongly encourages the treatment of medical tourists and even offers tax concessions and land subsidies to hospitals that treat them. The government has also made it easier for foreign patients to enter the country.
Ladies and gentlemen, welcome to Bengaluru Airport. Please remain seated and do not open overhead lockers.
India offers a special medical visa which allows a foreign patient and 2 family members to stay in the country for up to a year.
I think that's the way forward, because you have expertise in different countries which you can make use of. Why not utilize it? The world's become like, the world is flat, there is no doubt about it. All those curves are gone. Everyone's approachable, and technology has made it approachable.
Technology may be rendering the world flat, but curves and barriers remain for those who can't afford decent medical care. While private hospitals thrive and medical tourists enjoy facilities like these, India's poor have it a little different. The city of Hyderabad is home to the Osmania General Public Hospital. This hospital may look impressive from the outside, but conditions inside are appalling. This hospital once attracted patients from far and wide, but is now a picture of neglect and disarray. Staff here have to make do with limited resources to deal with large numbers of patients.
Because of the overflow of the patients, sometimes we fall short of the supplies. So at that time, like, we cannot compromise on some life-saving drugs or other equipment. So at that time, it becomes a challenge for us to accommodate and adjust these things from other places, like pull in from other resources, from other departments. So like this is where we feel a little disparity in supply and demand aspects of the requirements.
A former superintendent of the hospital, who didn't appear on camera, told me that chronic corruption and underfunding are to blame for the state of affairs. It seems the doctors and medical staff here are doing the best they can given the circumstances.
And then for investigation. ठीक होते हैं माँ, उसमें दवा मिला के दे रहे ना, उससे हल्लू हल्लू कम होता. कुछ भी बीमारी एकदम आता, लेकिन कम होने को टाइम लगता ना.
But despite their best efforts, this hospital and other public government-run hospitals in India are in bad shape. But while private hospitals thrive and forge worldwide reputations through medical tourism, how did India's public hospitals get to be this bad?
The issue with India when it comes to healthcare has been that it has been caught between the globalized and the marginalized. So we have an elite who can compete with the best in terms of money or whatever, in terms of luxury, and we also have the most marginalized in this country. Medical tourism is just a manifestation that anyway the public health system is weak, the private system has the capacities, bed capacities for example, and so propagate the medical tourism.
Saligram adds that the success of private hospitals has taken away the best doctors from the public system.
The problem of movement from public to private is very well documented. So you have chronic shortages of staff and infrastructure in the public health system. At the same time, you have 5-star facilities for the elite. And so
But what do private hospital doctors have to say about that?
I think I would probably agree with you on that, but the government is to blame on that. I'm on this task force with the government, I sit on those committees, and I can tell you every time I think I go to that meeting only to have tea and coffee and walk out because nothing comes of it. See, the government, like look at All India Institute, beautifully equipped, it's got everything, but you pay peanuts. And that saying goes absolutely right. You pay peanuts, you get monkeys. At the end of the day, the doctor also has his own aspirations, monetary aspiration. He needs his...
Medical tourism's defenders also point out that the success of private hospitals has attracted overseas Indian doctors back to India.
We do see a trend, certainly much more than what it was maybe 5 to 10 years ago, of doctors wanting to come back into India.
That's because if you give them the same technology, give them the same protocols and processes in place, they are happy to work. I think where India failed initially was we did not have systems and processes. We ran more on passion. With our IT industry growing and with us coming of age in those matters, we have now put those systems and processes which are pretty evident in the corporate groups and things like that. Not so much still in the government hospitals, but in all the private sector, it's a very refined industry.
It's also often argued that medical tourists, like regular tourists, help bring valuable foreign exchange into the country.
What makes it attractive for a country to have tourism in that particular country? It's really the kind of additional contribution to the GDP. And therefore, to that extent, it is revenues being earned by the country from overseas. It is something like an export earnings for the country. So it certainly goes towards enhancing or increasing the GDP of that country.
Sounds reasonable enough, but India's private hospitals have never released any data that demonstrate the economic benefits of welcoming medical tourists.
the private is not duty bound to reveal any data to any authority. We are not telling reveal patients' case records or whatever. What we are telling is somewhere somebody has to collect that. If the private is claiming or the medical tourism facilities are claiming that they are doing a great job of getting foreign exchange, let us know what it is.
But it's not just India's hospitals that are to blame for this bizarre absence of data.
In Parliament, questions are not answered by the ministers telling that how many people entered this country through medical visas. They don't have the data. Why can't the Minister of External Affairs know? And Parliament is the supreme body in this country. In a parliamentary questionnaire, in questioning inside Parliament, the minister has gone on record saying that we don't know how many people entered through medical visas. And you ask the foreign exchange earned, we don't know.
Saligram says the lack of data makes it impossible to pinpoint the positive or negative impacts of medical tourism.
If I am a medical tourism facility providing medical tourism facility, medical tourism capabilities or whatever, I would keep on telling that how great it is, how many people I'll get in, because nobody is going to cross-verify. There is no data to cross-verify whether I get 10,000 people this year or 20,000 people this year or next year. At the same time, the opponents will say, see, the government gives so much encouragement to private and the private doesn't help. So the government investment is going to subsidize foreign patients.
Doctors in the West are concerned.
Whenever a country receives a medical tourist, there are resources that need to be spent. There are administrators that will organize it. There are healthcare facilities, healthcare practitioners, nurses, secretaries, surgeons, primary care doctors, medical specialists. All of these people conceivably could be helping those who don't have access to the system otherwise.
Padukone disagrees.
The patients coming from overseas are from a completely different income segment in the sense that they can afford to pay, and therefore from that point of view they are not really depriving the people within this country of the healthcare that is being provided. So in that way I think both can coexist. people from overseas coming into the country and people within the country being provided healthcare.
Both already do coexist in some of India's popular medical tourism hospitals. L.V. Prasad Eye Institute in Hyderabad is one shining example. This non-profit hospital attracts plenty of foreign patients, like these 3 generations of a Nigerian family here to seek treatment for their youngest.
We started in Nigeria, but we were told that India is the best. L.V. Prasad was the best, so we had to go to L.V. Prasad.
Okay. So how long have you been in India?
We came last year, we finished, we just came back for a checkup.
So you've been here for a
Yes,
while?
we came last year. She had surgery last year. We came back this year.
But while this hospital attracts plenty of paying foreign patients from Africa and the Middle East, a big part of its mandate is to provide free care for the local poor. Over half the treatment provided at this hospital is free of charge. Money received from paying foreign patients is used to provide free and subsidized care to the poor. But unlike L.V. Prasad, most of India's private hospitals operate for profit. These private hospitals say they want to help improve the public system, but the government isn't interested.
If you sit in these governmental meetings, they will sit and say, why doesn't the private sector come forward and take it? I have myself offered to take over a district to reduce the maternal mortality rate. It's been 3 months since I made that offer. No one from the government has contacted me.
So it appears that India's healthcare situation is reflective of the country's long-standing dilemma: how to leverage the prosperity and expertise of its private sector to help improve conditions for the masses. For now, the status quo continues. Meanwhile, in the Western world, the medical community has come to accept the reality of medical tourism.
My advice to those people is, as this sorts itself out, as the world organizes to recognize, as Thomas Friedman said, the world is flat, that there are very few barriers anymore, that what we need to do is we need to take the information that we have, we need to take the technology that we have, and everyone needs to work together. And while I may be working one day with a surgeon in Vancouver, I need to be prepared to work with a surgeon in Mumbai the next day.
There's no questioning the value medical tourism holds for India's private hospitals and the medical tourists they attract. For the patients who come here, India comes to represent a new lease of life, or at the very least, hope for a healthier future. But while private hospitals thrive and medical tourism continues to grow, India's poor continue to wait to see if any of the benefits of medical tourism will trickle down to them.